When asked to present a policy for class, the first thing that came to mind was that dealing with health insurance and health coverage for young adults between the ages of 19 and 25, because this is the age bracket where young adults are usually in college, or if not, they are going through that phase where they don't really have the surmountable income to be able to afford health insurance. There are insurances that cover for children, but once a child is 18 years of age, they are automatically switched over to other insurances such as Amerigroup or Planning for Healthy Babies, and there are others, such as Grady Hospital provides an insurance for those who come through who are eligible because of low income or they are in poverty. These incomes provide the bare minimum of services, which can later affect the young adult. Some of these services may account to medications that might be free, but certain services that might not be free. So, in order to even get these medications, they are not able to afford the services in order to get those. Coming from a family that is low income, it can be hard to provide for financing of everyone's health insurances, but statistics show that 40% of children under the age of 19 are covered under government health insurance, which is basically our babies. Of that percentage, 20% of youth between the ages of 19 and 25 are also covered under government insurance. But young adults between that age bracket are the highest percentage of uninsured within the United States. And most of the adults stem from low income families or students who are in college. Some of the insurances that are available now are things such as Medicaid, Planning for Healthy Babies, which provides for only women's services needs, and that's between the ages of 18 to 42 years of age. And what that means is basically you might get free birth control, you get one free Pap smear. They don't provide for doctor visits throughout the year or emergency services throughout the year, which are definitely needs that women have, especially college women. Peach Care for Kids stops at the age of 18 years of age. Amerigroup is for low income families as well as those who are disabled older adults. Obamacare is the current policy that's put in place. The only thing with the Obamacare is that it does help provide for insurance for those who don't have it, but it's reduced medical insurance, meaning you still have to pay for it. There are definitely breakdown of plan types for various incomes, such as the lowest being the catastrophic and the highest being the bronze plan. And under each plan, it's like if you have this certain income or if this is a certain thing that you might go through, you're um, eligible for this insurance. But those services that are attained through those insurances are not that can help sustain a healthy living. This new policy that I will put in place covers adults after the age of 18 years of age until the ages of 25, and hopefully you'll be able to provide for more than just the bare minimum. So these are the years where students are definitely in college and things happen. And I would like for my policy to be able to provide for emergency services such as services to the ER, women's health medications, men's health medications, women and men yearly services such as Pap smear and whatever guys go through for their yearly checks, women's and men's health testing such as STDs, HIV testings. So those are some of the services, such as also accounting for doctor visits, which for hopefully for my policy I'll be able to place not a limit on health doctor visits, but just to kind of give a roundabout of how many doctor visits each constituent could take under this insurance policy since it is free. My policy will affect the low numbers of insured, and there is probably going to be a budget for all expenses used by the government, which can affect the quality of my policy and the services offered. There might also be a limitation to who can receive this insurance due to the pricey cost of medical service during this time. The thought of this policy stemmed from the many students who attend college and are uninsured, such as myself, coming from a family who is low income and not having insurance through my college years, so having to pay out of pocket for medical expenses and still having medical bills that are on my record because I was not able to afford those. This policy will cover students through college until they get on their feet a few years after. This policy also covers young adults who may not attend college but they cannot afford it, helping them keep an insurance through the age of 25. This policy initiative is surrounded around those who are in school but will not single those out who are not. And for the young adults who are not in school, they must have a $10,000 a year or less income, be able to show for that. A critique for my policy is making sure that I cover all bases with eligibility for this insurance policy. This will help guide me for who can receive these benefits and who cannot, but they fit in this age bracket. There may also be an issue with how much money is budgeted towards this policy, which can limit which services are provided under the policy. But more research will definitely be found once I am able to look more into it and start writing on